Minutes past 8 as we kick off this morning, taking a look at the NHI Bill and looking at the consequences of the bill, the passing of the bill, and its likely impact not only on the healthcare system in South Africa, but looking at private healthcare practitioners. And this is the reason why we are talking with the president of the Health Professions Council of South Africa and health activist, Dr. Kgosi Letlape. Dr. Kgosi, good morning to you and welcome to the show.
Good morning to you and the listeners.
Yes. Now, Dr. Kgosi, talking of the NHI bill, looking at for a long time now, we've seen private healthcare groups warning that the planned implementation of the NHI scheme could have far-reaching consequences for the healthcare system, but also at the same time looking at healthcare practitioners and the impact on them. And there has always been this talk about waves of doctors and other skilled professionals leaving the country as a result of the implementation of the bill. Just your thoughts, sir.
I think it is true that any attempt at creating a central fund will have far reaching implications for all sectors, in particular the private sector. It is something that should be welcomed, but it is something that should be done properly. I have no problem supporting NHI, but I have serious reservations in terms of what is being proposed and how it is going to be implemented. For example, the governance structure is not what I would support. We want something that would be under Parliament, where there would be broad public participation about who runs that fund. It should be a process that is open to public participation, that is under Parliament, not a process where one person, a minister, can make those appointments. That would be an extremely, extremely dangerous trajectory.
Well, it
With
certainly is
respect
because,
to how it will affect practitioners.
sorry about that, sir. I think
Yeah, I
what
was
you
saying
are
that
saying,
with
and I just
respect to how it will affect practitioners.
continue.
You can carry on, right?
Yes, I
Inayet, you
think
can
we've
carry on.
I think we've got a bit of a delay as a result of the signal strength, and this is the reason why we see the slight delay. But I just want to interrogate this whole issue about the state and its ability to manage and administer the NHI, and looking at this total administration and management of funds. Is that the major problem as far as your concerns are concerned in this particular regard?
It's one of the many, many problems. The other problem is that we cannot call it national health insurance when it is not for everyone. The government should be starting by putting themselves on that national health fund. We can't have parliamentarians having a separate medical aid, government servants having gems, and you creating a separate pot of money. If they do not go to this fund for their own healthcare, it'll just become a honeypot that people will abuse. So one of the key issues about national health is that it has to be for everyone, and we must start with our leaders being in that fund. If you
Well,
start with the marginalized people, you are creating a third tier to our already fractured healthcare system. It cannot be that we're creating a third pot of money or a third stream of the healthcare system.
yes. Now, looking at some of the key industry players, and also in terms of getting a better understanding of healthcare services as it stands right now. Now, we know that we do have a problem in the public sector as far as health services are concerned, but also at the same time, the clarity that the private healthcare system is actually seeking from the government. And the key issue here is to look at what impact this is likely to have on healthcare practitioners in South Africa? Because there are major concerns from what my reading into the situation is. There have been a number of surveys that have been conducted, and the respondents are concerned, and this possibly could lead to an exodus of healthcare professionals leaving this country. How major is this concern, Dr. Kgosi?
Well, I am concerned, but for different reasons. I'm concerned for the fact that this fund will now be the one that determines who can practice and who can't practice. They are giving themselves the powers to contract with practitioners. The way it should occur, where it would offer us a sense of security, is that the people will continue to choose whoever they want to see. And anybody that is prepared to work for the fees that will have been negotiated by the representatives of the profession and agreed upon with the fund should be allowed to see patients. There should be no picking and choosing, where if they contract with you, you can have a job. If they contract with you, you are in the wilderness. We do not have sufficient healthcare professionals, and the ability to practice should still be left to the statutory bodies. The fund should just contract with all practitioners that are properly registered with the relevant statutory bodies and willing to see their patients. It should not be a matter of contracting with the fund. The fund, we don't have enough healthcare professionals, and that needs to be put in the bill. The fact that you now have a new fund that can now contract will be open to abuse, will be open to corruption, and does not give us security of tenure, of being able to continue to earn a living and serve the people in our country.
Yes. Now, the fact that the total administration and also looking at the management of the funds, the decision making is in the hands of government, is in the hands of the state. And as you correctly mentioned, in terms of enforcing tariffs, place of work, and also extending to things like types of diagnostic tests and types of medication and treatment, these obviously are major concern, and taking the healthcare system out of the hands of private practitioners. Now, for someone like yourself as a health activist, I'm sure representations have been made to the government. How far are we as far as some of the lobbying and
Well, we
representation goes?
uh, I think the problem is, if this is going to work, it can't be state controlled. It has to be people controlled. It has to be an independent Chapter 9 institution that runs the fund, not a department in the Department of Health. That will not work. That's a recipe for disaster. And if it becomes a Chapter 9 institution, you can then bring all the expertise that is available for the specific purposes of running the fund. There is no expertise or competence of running something of this nature in the Department of Health. And it would not be helpful to make it a ministerial competence. You've got to create an independent Chapter 9 institution. If you look at the current methods, there's something called the Council for Medical Schemes, which is a separate Chapter 9 institution that regulates medical schemes. You need something of a similar nature. But given the importance of the fund, the magnitude of the fund, the appointments should not be made by a minister. The appointment should be made through a process similar to what we do for the board of SABC through Parliament, with greater people participation, so that every candidate that puts out there has to be assessed for competence, for history, for appropriateness for the job, and for ethical conduct in their past. This should not be something where people get run that fund. That would be a calamity.
Yes, and also, Dr. Kgosi, just finally looking at or the government's motivation and saying that this is a more complex issue than just the NHI, and talking about a population of more than 55 million that need to be served as well, and just looking at where we are from a public health perspective, and we know what has been taking place in hospitals, the corruption, and just generally the problems that the public healthcare system is experiencing. How would that be overcome?
That would be overcome by putting the choice in the hands of the patient and the fund being able to procure services at agreed rates from any participant, whether it's a competent public health institution or a private provider. That should be what is in there from the beginning. We can't use this fund as a fund to resuscitate a public healthcare system that is being bedeviled by corruption. There's nothing wrong with the competencies of public health structures. Powers need to devolve to CEOs, and the institutions need to be able to compete. But they need to have the power and authority to employ competent people, to fire incompetent people. There should be no basis for political deployment in public service. It should be competency based. So from the beginning, the fund should be able to procure services from whoever can provide those services properly. If you take an example of what happened with COVID, the government was the only group that purchased the vaccines. But the private sector was also brought in terms of being able to be sites for vaccination. The same thing should be done ab initio with this fund. It should not be that, oh, we're going to have a pot of money, we're going to fix public health care hospitals with this. The problems in public health care are problems of inappropriate use of money, inappropriate staff, and cadre deployment. You get rid of those issues, the public sector will recover. We have dedicated healthcare professionals that run the public sector. It is the funding being run by political structures, by provinces, that makes it not work. Health must become a national competence. Creating a national health fund will begin to move us to that. But that health fund should not be deploying funds to other structures like provinces. That health fund should be procuring and paying for services for all South Africans and contracting all service providers, public and independent.
Well, Dr. Kgosi Letlape, we thank you for that. Unfortunately, time is of the essence. There's just so much more to unpack, but I'm sure at some point in time we will connect again. But for now, we thank you for your time with us on Salam Media this morning.
Thank you, and thank you for the opportunity. And it's time for ordinary people to become engaged with this subject, because
Thank you
this
for that.
has profound effects on all of us.
Thank you for that, sir. Dr. Kgosi Letlape, President of the Health Professions Council of South Africa, also a health activist with us this morning, and his take on the NHI and how it is likely to impact on the country and our health system. We're going to go for a break. We come back, we'll be joined by Catherine Sutherland, legal researcher at the Equal Education Legal Center. Another bill talking about transforming and changes to the education system. We're going to go for a quick break. We'll be back.